Thank you for asking me to talk about the penile cancer. Unfortunately, the patients don't talk about it, and that's why I'm here to talk about the penile cancer. When I say the patients do not talk about it, we really have to understand the psyche behind the patients coming late to the clinic. An extremely important organ for the men. If anything happens to this, you would have thought these patients would quickly see the doctor to find out what's wrong with their genitalia. But in the developing countries like ours, in India, with the fear, with the shame, with the guilt, people try not to go to the doctor, and unfortunately I must say, even after working for about 3 decades, we still find patients coming in advanced stage in India. As against to the Western world, many patients would go to the doctor and try and get treatment of the genitalia lesions at the earliest. Now, whatever it may be, many patients who present with penile cancer present with inability to retract the prepuce. They have bleeding, staining on their underclothes, and sometimes they develop an ulcer or a growth which doesn't heal over the period of time. One of the mistakes people do is try and self-medicate. Another mistake people do is trying to go to a skin doctor or paramedics or non-allopathic treatments where they try and apply some creams and medicines and herbal treatments which is not going to diagnose or cure your disease. Now, the penile cancer can be either limited to the skin involving of the penis or involving the entire length and breadth of the penis. Now, what is important in India is if your penile hygiene is very poor, if you are not able to retract your prepuce properly and the hygiene is poor, that is one of the important precursor for developing cancer. The other important element in developing cancer is HPV or human papilloma virus. Now, whatever it is, once you make a diagnosis or a suspicion you have for a penile cancer, it is important to establish a tissue diagnosis, meaning a biopsy, and also find out what is the extent of this penile cancer. If the cancer is limited to the part of the penis, we can only remove that portion of the penis, and rest of the portion of the penis can be still maintained where patient can have a normal act of micturition and can have a normal sexual function. If the lesion is progressing towards the length and breadth of the penis, then perhaps you may have to sacrifice the entire penis and do an operation called as total penectomy. Now, the whole crux of cure depends on whether you have completely done the surgery or not. And what I mean by completeness of the surgery is whether we have addressed the lymph nodes which drain the lymphatics of the penis, which are mainly in the groin. The common mistake which is done by many surgeons and many people is to address the primary and wait for the metastasis to develop, especially when you don't feel anything into the groin. And I don't think that's the right approach. This, what we call as an N0, meaning at the first time of presentation, if there are no lymph nodes palpable, even on imaging, these patients still have an inherent risk of having a micrometastasis in the lymph nodes. Now, how do we know whether these patients have a micrometastasis in the lymph nodes? There is no good imaging which will tell you there is a microscopic metastasis. So the only way you would know by doing either a sentinel lymph node biopsy on the groin or doing a modified dissection, inguinal lymph node dissection. Now, in India, many patients present with advanced disease at presentation. They have moderately to poorly differentiated squamous cell carcinomas. So in our practice, apart from dealing with the primary, we deal with the inguinal lymph nodes in a prophylactic fashion. Last 2 decades, we have witnessed tremendous change in the cure rate of penile cancer because we address the lymph nodes at the same time. Now, the question is whether we address the lymph nodes on one side or 2 sides. To my mind, I think along with the dealing with the primary, if you deal with prophylactic lymph node dissection on both sides, with which you can minimize the morbidity of the operation, still cure these patients and have a proper staging. If at all the disease is involving the lymph nodes, you may go 1 stage higher and go into the pelvis and remove the lymph nodes on both the sides of the pelvis. Having done that, I think these patients can have an excellent quality of life Again, I re-emphasize the idea, come to your doctor early, don't be shy, don't run away from this, and you still can have a good sexual life, good maturation, and you can get cured from this dreadful disease. Patients who present very late, there is a little bit of hope by treating these patients with the TIP chemotherapy, but I'm sure nothing like people coming in an early stage. So don't be shy, don't be afraid, and if you are not circumcised and if you have any lesions in the penis, make sure you get investigations done and get treated by a proper urological cancer specialist.